Thank you. So we have begun. Uh, you all got the email from me. I'm sure I sent the same one to all the 3 classes of mine that are doing that tomorrow. So I'll make every effort to keep an eye on all the texts that potentially people might say. Hopefully there won't be any. I'm hoping there are no glitches, but since it's my first time doing the Blackboard Ultra, Blackboard was relatively easy. We'll see what happens. So hopefully you'll be able to open this and we'll go from there. Let's see. So that's the first thing that's there with regard to noteworthiness. Today's lecture, I added something. Let's see. So that's this. This particular, I just put this on this morning. It's about immunological based diseases, diseases that affect the immune and the lymph. Things, I mean, basically these are things like what I don't really necessarily cover here, but it's useful information for you to look at. And I'm putting it because I'm going to start the program with Lyme disease today. So this is where to find it, just under week 5. I popped it here this morning, so you'll be able to see it without any other information to present. We will begin. Then we'll return to that skin one and pick up, because really this is the last of the really important bacterial disease of the skin. Then we'll go to viral diseases. And moving on. So, I mean, this is, and I'll go back and backtrack into the PowerPoint to give you an idea. If you want to browse through, this is a pretty good idea. And hopefully these are not things that you're going to run into. And you would have had this in an immune system and in a variety of different things that are there. And so these are diseases that affect the blood or travel through the lymph, trigger your immunological responses. And they give you some of the anatomy which you had before. Quickly, that's a thing called lymphangitis. We used to call it blood poisoning. But the reality was, it wasn't in the bloodstream per se. It was a surface lymphatic vessel that was becoming inflamed. That's scary to see that. And I have seen that before. I remember seeing that with the smartest guy in our 7th grade science class, which really happened to be a really good class. And all of a sudden, he's got one all the way coming up from his elbow for some kind of finger infection. To give you an idea of how severe and how fast things can travel. He didn't even know he had it. And all of a sudden it was there. So I don't want to go over this. You heard me mention in passing certain things that could affect the heart. And endocarditis, this is typically on a valve. There's a variety of different things can do it, but it has to do with basically organisms traveling in the blood rather than in the lymph, etc., and extraordinarily, when it's acute, extraordinarily dangerous. And you can see these are relatively common. So again, this is not something I'm going to ask you a bunch of questions about. Other than the Lyme disease, that's the part of this particular exam that I'm interested in. But I mean, it gives you a chance to look at these things. We've talked in passing about gram-negative sepsis or septic shock. And again, it has to do with that lipopolysaccharide, which you're going to be mentioning very shortly. Might I add, gram-negative bacteria and the endotoxin, etc., are all part of this little picture. And here's one that we don't cover, but it's certainly worth commenting on, and that's plague, which, if you did not know, is a bacterial infection. It gives you an idea. Again, we still think the largest single killer. We have to understand about it was that swine flu back in 1918, 1919, based on a number of people who died from it. But if you're thinking about something that killed a quarter of the population in a 4-year span, plague's pretty impressive. And smallpox is probably in that same category. And the fact that it's classified here is because it goes into the lymph nodes. And the lymph nodes swell and get blackened, hence they name Black Death. And they'd be under the surface, you see these mounds that were really lymph nodes that were necrotic and turning the overlying skin black as part of the deal, and hence the name Black. And then when it would get, the problem when it really became a deadly killer wasn't from the rat bites, or not, rather from the flea bites that had gone off the sick rats, but it had gotten into the lungs. It became pneumonic plague. Now people were coughing it out and could pass it to one another. Bubonic plague is zoonotic. Pneumonic plague now is person to person, and respiratorily spread. So again, an endotoxin here, it's this tiny gram-negative rod that lives inside cells. It's got a fancy name, but you won't have to know, called Yersinia pestis. Originally it was called Pasteurella pestis many years ago. They changed the name, just making a few comments. And again, the only time we would rarely see this, very, very rare. Again, rat control areas with inadequate hygiene and rat control, and rarely we see it in this country. Which brings us to the topic for the morning, really. The one that one, because there'll be questions on it on the final exam, and two, it's the sentence says it all. 30,000 new cases each year. This is 8 years ago, and there's more now. The most common vector-borne disease in the United States. And I said to you before, you are right here in Lyme disease central. And you are now in Lyme disease season, as you will look when they go into it, and it's roughly April through November. It starts when it really starts at spring, and even like we are now in early spring, and continues on into relatively late fall until there's some really good hard frosts. Okay, a couple of those might take care of it. And that's where we begin. It's an interesting disease. It got its name from where it was studied in a cluster of cases in Lyme, Connecticut in the 70s. We knew about tick-borne illnesses before. When we were learning about them in my microbiology course, they called it tick paralysis. All they knew was these are tick bites, and sometimes people undergo and they get so sick, and the next thing you know, they can't move something, and they're in a lot of pain, and blah blah blah. And we're all looking at each other, really, but that and what causes it, they didn't know. Is it passing a virus? Is it passing a toxin, etc.? This is 50 plus years ago, everybody. So, and we didn't have a name for it. So, and what you're going to see, this is carried by a bacteria. This is the first time we're going to look at a bacteria seriously that's a spirochete. The other one we're going to look at has a very, very similar mode of operation. We look at that next week in genitourinary diseases, one of the most famous diseases of all time, called syphilis. Okay? And so these two diseases are caused by gram-negative microaerophilic spirochetes that get into the bloodstream and provoke an extraordinarily active immunological reaction. Hence, the reason they're in this chapter and no longer in the skin. They were in skin originally because of that, called a target or bullseye rash, which is characteristic of it. And everybody, if you haven't seen one, you're probably going to see one. Okay? It's more common than you think. And so what happened in this particular way, doctor, his name was Willy Bergdorf, he was studying this cluster of cases. He was able to identify the bacteria, very hard to cultivate, very fastidious. And again, it's the good news about this is that if you can identify it early, it's relatively easily treatable because a lot of antibiotics will cover it. If it's too long, it gets extraordinarily hard to treat. And as you will see, it takes approximately a year of antibiotics. Another one of these with a year of antibiotics. And I have a very interesting anecdote that I will tell you about ever so shortly with regard to my I kind of framed it, I was a little preachy on Monday, not trying to prejudge and things like that. We all make errors like this. It's very hard. And until one kind of bites you, you really don't appreciate, I should be a little bit more accepting that when people are coming for help, a lot of times they really need help. But more on that in the other. So, and understand, this is another problem. It's not necessarily always painful or that noticeable. So one or more of these may be asymptomatic. There may not be a rash, though the rash is common. More often you don't see the rash. And the rash forms this way because it starts here as it begins to spread, then it colonizes here, and hence the name is bullseye or target-shaped rash. That's very characteristic. It doesn't have to be like this. Maybe the one time before it disappears completely, you'll just see one isolated, somewhat circular area of this. The fancy name is called erythema migrating. Redness that's migrating. It's really where the term comes from. Bless you. And so whatever they want to call it, bullseye rash, target rash, whatever you want to call it. So the interesting thing is it does disappear. And what happens then, the mistake, and you'll see this the same thing I'll tell you about syphilis. Oh, I'm better. It went away. Out of sight, out of mind. The reality is it's gone inside by way of your bloodstream and travels by way either to the lymphs or by the bloodstream directly into the lymphs, into the lymph nodes. They enlarge, and then you start to get the next phase. And we're talking about not necessarily days later, but weeks later. It may take days or weeks for the first one to show, and then days or weeks for the next time to show. And all of a sudden, we're having a much greater problem with regard to that. Turn up my phone. Did. And you can see some of the symptoms that are accompanied by it. Chills, fever, headache, joint pain, fatigue. Kind of nondescript, but very influenza-like. Oops, sorry. Make sure I'm doing it the right way. And so now at that point, we get to the next real phase of this, where it begins to disseminate, which means to spread. 2 to 8 weeks later, we start to see impairment of the nervous system, particularly the neuromuscular system, dizzy spells. So this is really the official phase 2 that begins here. Fainting, headaches, pain everywhere, numbness, emotional instability, all of these things that I've seen. And then lastly, 6 months after all those initial presentation, the rash and this kind of pain, okay, chronic impairment, even potentially death. They don't describe it here, but it can be fatal. One of the earliest, I went back to my 40th high school reunion. You have a board with the people who had died, and there was one person who was kind of in your, you have a big high school class, and you're in the circle of friends that we all palled with, and I see her name, I was like, oh my gosh. And I asked my friend who was a class president, I said, because I know he had something to do with the planning, it's like, how did she die? He goes, Lyme disease complications. I'm like, oh, Jesus. And it really was an awakening for those kinds of things. I've seen patients with it. Here's the agent. He named it after himself. They always do. Bergdorferi, Borrelia burgdorferi, relatively large. It's a spirochete, microaerophilic, but gram-negative is the key. Plasmids with genes, usually found on chromosomes, no big deal. Tick bite, circular fashion, bloodstream, flu-like symptoms, immunological response is the key. Most likely it's triggering some kind of autoimmune response. Got it. Here's the other part. Look how small that is. That's paperclip. Look how tiny that is. Easy to go unnoticed. Not know where the bite was. And where ticks bite you, by the way, everybody, all the cases I have seen have been upper thighs, underarms, thighs going into the crotch area, arms going into the axillary area, because they seek out warm, dark, moist places to get a blood meal. So I think under clothing, where it is, it's not going to be on your hand or anything like that. One, it's much more noticeable. These guys are tiny. And a lot of times just doing that doesn't get it, because that head is embedded. It's not easy. Did you ever have a tick on one of your animals and have to remove it? You have to get it, and you can get them anywhere. You can go into, you go into Walmart, these little plastic things that you sort of put over the tick and turn it around and it lifts it. So it's tick remover. We used to have them in the emergency room. They are not easy to get off. So just do it. I got it. It's not like a mosquito or something like that. Very hard. As long as that's embedded, it's still passing on the microorganism into you. Okay, number of species, the one that's most common, of course, the deer tick. Ixodes scapularis. Ticks have great names. Okay, most often we see this is the one that did. Very high percentage of these ticks are assumed they're infected, because typically they are, certainly around here, and that's absolutely true. They're super tiny. Look at the dark green areas. And what's common about those? Areas where the ticks grow, where there's standing water. You go through these little ponds and things that aren't moving very much. You get all that green stuff sitting on top. That is not where you go walking around. Get away from that right away. We used to go over those places as kids growing up in the marshy areas and the lowlands of New Jersey. Same thing around here. So they found out what was going on. It was, oh, this is kind of neat. No, let's go exploring. Oh, it's kind of wet. No. we really didn't know what we were getting ourselves into. So that kind of stuff, you can see this is extraordinarily common in all of these areas, whether it's Connecticut, New York. And the other thing is because of, you'll see with the life cycle of the deer, because the deer is a part of the life cycle. They really don't get it from the deer per se, but it has a 2-year life cycle that they show in a relatively distinct fashion. So what happened, the female drops and lays eggs undetected. Those eggs kind of fall off, and they're falling off down here of the deer. That's kind of where the mating goes on in this 2-year life cycle. So after they mate, this is what happens. So they drop from the host. The female drops from the host, which is typically the deer. And they hatch these little larvae, and they immediately seek out a blood meal. And typically, it's something like a mouse. It could be a dog. Dogs are prone to this as well. But typically, they start with a mouse, okay? And at that point, that's the first year of their life cycle. At that point, they become dormant, and they undergo the typical metamorphosis into what you and I call the tick. This is a nymph tick, small tick, not a large tick compared to what you saw, which was compared to a large tick. That then jumps on something else for another blood meal. It could be another mouse to infect. It could be the dog you're taking for a walk. Our dog got it. I think I told you that. Okay, fortunately, it was detected. We did a heartworm screen. They found out it was him, gave me antibiotics. It was fine. Thankfully, got it early. Or it could be us. And typically, think of what you're not wearing long pants when you're going out. Just in a nice time of year in the middle of the summer, walking, going for a hike or anything like that. Once it's finished with us, then they mate to complete their life cycle. And the mating, typically, the host where the mating occurs and where they complete their 2-year life cycle is here. The female becomes dormant, male dies. Okay? On the deer. And that is, we have all the combination of those things. Mainly to be responsible for transmitting it is that nymph stage, that stage that's there. Preferred host is a mouse, which spreads the bacteria to other ticks, blah, 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 blah. Deers are the preferred host of the adult ticks. Mating occurs in the deer. Very, very widely spread. You can see the peak incidence. Keep that in mind. So just to complete this before I tell you the anecdote, the antibiotics, very effective in early stages. Later, much less so, okay? You have to use much more aggressive antibiosis and for much longer period. We're not talking about 2 to 3 weeks. Early stage, we're talking 3 to 6 months, maybe a year. And again, avoidance is the key. Understanding the areas where they might be likely to avoid to stay away from. If you love to do this and camp and hike, take appropriate precautions with clothing. I don't know if they're readily available because of the environmental aspects. I mean, whatever, we used to have something called DEET, D-double-E-T. I do not know if that's still available. I'd check on Amazon if you're intent on doing this. Maybe they have it. And yeah, there's no vaccine. Well, that covered that pretty straightforwardly. Let me tell you 2 anecdotes. One very personal. During the lockdown, March 20, like all of us were sitting at home. I don't know what you did when you were at home. It was my wife and I, it was just the 2 of us. We did a lot of walking. We did a lot of work in the yard, a lot of work gardening and stuff like that. She got it. One day, she's like, we're sitting on the deck having lunch. She's like, I don't know, this is just bugging me. I don't know where I got this. And she sort of she kind of does this, and there it was. It was like bullseye rash starting. I'm like, that's Lyme disease. No, it's not. Yes, it is. She said, don't believe me. I couldn't go in with her because those days, if you went to like an urgent care, if you weren't the person needing the care, you weren't going in. I think she saw a nurse practitioner there who looked at it and goes, that's Lyme disease. Here's a prescription for 3 weeks of whatever antibiotic. It wasn't monstrous. It was probably a tetracycline like fibromycin, something like that. Pretty straightforward because it was early stages and no problems afterwards. Okay, she didn't know where she had gotten that tick, but understand, Cranberry Township is tick central. I mean, I walk the dog in the morning this time of year. Well, I see deer it's everywhere. In the backyard, rabbits, deer, the whole, well, dog's very interesting. Now, okay, that was the easy anecdote. Now I'll give you the one that's troubling. And the one, and really that's why I take some extra time to frame this. Don't be like me. I'm trying to avoid so you don't have to have this unpleasant learning experience. I didn't practice, I'd already been just like 95. Good 30, I have no idea what happened this week. At that point in time, when I probably had not seen a case so dramatically at that point in time. And it was not the original case. There was no target rash. This lady came in very brusque. She was young, I'd say mid-20s. I'm going to be kind of scruffy looking. Not well-dressed, not overly, and very agitated. Not very well kept, whatever the word is. And I said, you take people at face value, you should. Sitting in there, okay, what seems to be the problem? What's been going on for a couple of weeks? I'm in such terrible pain. I said, does anything help your pain? Does Tylenol help? Ibuprofen? Oh, no, just this perk of something stuff. In the back of my mind, I'm going, oh, drug secret. Well, how did it start? Oh, I don't know. It just started. Well, how does it hurt? And you try and move. See, it hurts every time I move like that. And I mean, she was, and not, just sort of the vibe she was giving off struck me as there's something about this. I smell a rat. But I wasn't that judgmental. I said, okay, I will give you a prescription. You can't put refills on that stuff. It's class 2 narcotic, class 2 controlled substance. And gave her enough for, a week or so. I said, here are all these blood tests. I wanted to do a workup. I want you to go and get those done. You come back. Here's an appointment in 2 weeks. If I don't see you in 2 weeks, I can't give you any more prescriptions. Well, she missed that appointment. So in the back of my mind, I'm going, okay. I probably was right. A week later, she comes in. My office manager said, oh, she made an appointment. She's coming back. I got the blood tests. Okay. And there was some areas where it suggested slight irregularities in the immune system. So the blood count was a little off. I hadn't done a Lyme disease type. That had not occurred. Now, this time she came in, she looked much nicer, better dressed. Interestingly enough, she came with her husband. The more interesting thing was she was in a wheelchair. Absolutely true story. Her husband was bringing her in. She could see, and you can tell if somebody's faking pain. So she comes in with her husband, looked very concerned, and barely in tears, and we both had to lift her as gently as possible to put her into an examining chair out of the wheelchair. She was just pain. What in heaven's name is going on? Oh my God, it got worse. Oh, it's terrible. And I'm looking at the blood test again. This is very confusing because there's some stuff that's suspicious. And in the back of my mind, maybe she's starting something like rheumatoid arthritis because that's in the right age group, 15 to 55, that kind of area. That's when we see autoimmune diseases rear their ugly head. And I said, how did this start? She goes, well, my husband got laid off. They lived, I believe they had a student from Corey. If you know where Corey is, okay, that's between, she's outside of it. She's like in Spartansburg. That's between Titusville and Corey. All there is in that area are Amish folks and deer. And I knew it very well, the whole area, because I practiced there. Really, she goes, well, my husband and we couldn't go away. I've got 3 little kids. All I can do is take them on hikes. And that's all I did over the summer because this was in the fall. Hikes? Really? Yeah. She goes, yeah, there's just all sorts of bugs and ticks. You got to be so careful. Ding, 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 ding. Okay. Oh, shoot. At that time, up in Venango County, there was not, now there's, UPMC has something called UPMC Northwest up here, if you've ever been to that area, that services Oil City, Franklin, Clarion to a certain extent, Titusville to a certain extent. Big area now. And at that time in Meadville, there was an infectious disease specialist. I got on the phone. I referred her right away. And yep, he did Lyme disease titers. And yep, Lyme disease positive. I had a little follow-up that she was doing better. She was probably in stage 2 by that time. So hopefully we avoided stage 3 with any permanent problems. But she came back in. The doctor said I have to take these antibiotics for a year. The moral of the story: don't prejudge. I almost missed it because all I could see, because I remember my office manager came back. She's a drug seeker. I agreed with her. You're going to run into plenty of drug seekers. Your index of suspicion will be like that. That's the moral of the story. So here we have it. Best thing I can tell you about it. Nice summary of it. You can look through the rest of these if you like. There's some interesting things. As you can see, interactions with animals are sometimes problematic. More animals can bring you these kinds of things. So it's kind of interesting. They're not that common. You might want to look through the mono, which is common. We talked about with herpetic infections, etc. Unless you're traveling, okay, you're probably, unless you're doing a medical mission or you're traveling, it's extraordinarily unlikely that you would ever contact this. But it is still there in Africa. I mean, for people who are interested in serving in those areas, that is certainly a concern. So let me go back to skin diseases, and I hope you appreciate, I really felt it was important to take this time to explain both of those, not just to identify Lyme disease, because if you're going to work anywhere around here in the Northeast, you're going to see it. Got to. Moving on. So we stopped with anthrax last time. This was kind of disappointed. For those who are not here, you got to get your team in order. It's on you, Vicky. You're the team captain. The trio doesn't, they have their own captain. It's a small class. I know who's not here. It's like Santa. Naughty, you're nice. I got that. I keep telling people that. It's like Santa being Jewish. Who else would work on Christmas Eve? Don't be offended. It's just trying to be funny. I'm sorry. So we're not doing anthrax, but I was talking to my colleagues today. Did any of you ever have chicken pox? No. You were all immunized. And you have measles, mumps, German measles, none of the above. These were all the usual childhood diseases. They were pretty nasty. I mentioned that to you when we talked about resurgent diseases, having chicken pox and measles parties. Our moms did. Gotcha, Ruth, on this one. You, Mrs. Jacobs, Mrs. Lichter, you were all there. Don't deny it. You're probably all gone. But understand, they wanted the kids to get them. They wanted the kids to get a good dose. Because in this country, thankfully, even though they were ever, and measles is probably the most contagious disease that we know of. I mean, more than 95% of the people who are exposed get it. In my day, I mean, you ask anybody before the MMR immunizations became available, they all had the measles, and we all survived it. There are some deadly complications. That's when people don't know. But I'll start with this one, chickenpox. You've all been exposed to it. You either had it, which you guys didn't. You were immunized for it, which all of you guys probably were. Or even if you were neither of those, you had become exposed to it, and for whatever reason, you have got the virus inside of you, but it was asymptomatic. Okay? And once it enters you, this is what it looked like. Okay? Tiny little papules. They were red spots, macules. Remember I told you about them? They got bumps. They became papules. Then they opened up into little blisters. And anywhere in the body, but they typically begin head and chest, and then people were completely covered. They're extraordinarily itchy. And the biggest problem you're going to see with a lot of these viral diseases and a lot of fungal diseases, secondary bacterial infections. We scratch. Dirtiest place you have under your fingernails, they're full of staph and strep. Okay. Mom would threaten to tie your hands up to the bed. They covered you in calamine lotion. They put you in a bathtub. That's what we did with our kids. They put you in a bathtub, Aveeno, which makes a very good product line. now of skincare products, they made something called colloidal oatmeal. And it was so itchy, and you fill the bathtub with it and plunk. I remember plunking my 2 boys in that type of thing. Okay? And it's different in different kids. I'll explain that to you in a second. It is scary. I probably said it before. What is called varicella, like any of these childhood diseases, much worse in adults. So in the unvaccinated population for this worldwide, pneumonia, it starts respiratorily, remember that, but its manifestation is on the skin. And all of these things, and immunocompromised. My middle one was having a GI workup at Children's. They used to admit you for this. He had irritable bowel. It turns out he had something called eosinophilic gastroenteropathy. At the old Children's Hospital, which is where Presby is, rather than the one that's up in Lawrenceville now. This was how long ago it is. He's 41. He'll be 42 next month. This is 40 years ago. They're doing a workup. They put him on a clean floor because they were just doing a GI workup. He wasn't sick. We found out there was an outbreak of chickenpox to be expected in the play group at the local Y that we lived at up in Oil City, PA. So he immediately told the attending physician and the nursing staff there who were full-time there. At that point, they put him in reverse isolation. Maybe I told you about this. I was the one staying doing the overnights. We had to cover him when they took him down to the GI lab to do things on him. We were effectively, the only reason we could leave the room if we were staying with him was to go to the bathroom, which is across the hall, and come right back in, all gowned and gloved and masked. Because in the rooms next door where they put him in, there was a liver transplant kid. There was an orthopedic case where the kid had multiple procedures done. High-risk cases that you don't want anybody with infection near them, and all of a sudden, here it comes. A liver transplant kid who's already immunosuppressed and using immunosuppressive drugs being exposed to chickenpox could easily die. And that's as true today as it was 40 years ago. So understand that this is not innocent by any stretch of the imagination. Notice all of those things. And we talked about it. It's latent. It's a herpes virus, VZV, varicella, the chickenpox, zoster. Shingles are very angry. They don't look the same. These are all over, itchy, scaly, until they dry up. You're still pretty well infectious. Shingles is not quote-unquote infectious. Theoretically, someone who is not vaccinated would get the chickenpox. So you can't pass the shingles, but you could pass the virus, the initial presentation of chickenpox. Extraordinarily painful. I have seen them in patients in the hairline, into the eye, along the whole face. One of my colleagues here had to stop teaching for about 3 weeks because they broke out on his face. So painful. I've had people, the biggest problem I had treating shingles is getting people off pain pills. We didn't have Valtrex and those Ciclovirs that we talked about in antivirals. All we had were pain pills and probably topical steroids. We didn't have an antiviral that at that point in time that would work efficiently. Those have been relatively recent. As you can see, wrist to the eyes, etc., etc., etc. Following sensory, remember it goes latent along the dorsal root ganglia, the base, or the root area where all those cell bodies clustered together. That's a ganglia on any sensory nerve in your body. Not fun. Not a whole lot of treatment. VZV, a herpes virus, respiratory, replicates in lymph nodes, go all over the place, etc., etc. A lot of big problems. What brings on shingles? We don't know. Anything that causes a decline in your immunity. There's a case that was where this lady had it, and I such a nice lady. I treated her for years, and she was very active until early into her 80s. She drove. Her husband did not, as he had gotten older. She was driving. If you're familiar with Route 8, coming up from Butler, going north, and Route 80 at that intersection, she was in a crash. She felt it was her fault. She survived. Her husband did not. Her stress was absolutely true. Her stress was so bad, all of a sudden these developed, and they were there for the better part of a year. Pain was intense, couldn't comb her hair. understand it's a really significant thing. You will see it. Okay. So shingles coincides with that decline. Stress, loss of a loved one, life change, divorces, death in the family. Pick one. And some other thing is declining, a medical problem with your immune system, a reaction to medications you're taking. Pick a reason. All of those. It's notifiable because we have immunizations. We shouldn't be seeing it. In the early 90s, 4 million cases a year, a decade after the vaccine release in 95. Varicella was after MMR. My kids all had chickenpox. Now, I told you they're not biological siblings. They had 3 different presentations. My oldest had typical, covered in spots, itchy as anything. Yeah, fever 102 to 104. We had 2 other little kids. Adam was 4 at that time, or 5 at that time, which I think still in preschool. Shipped him down to grandma and grandpa here in Pittsburgh. All good. 2 weeks later, my middle one gets it. Didn't slow him down. Barely a spot. He had enough spots to call it. Didn't slow him down. Still super active. Mild. We were disgusted because you wanted, like any appearance, we wanted a big case, build up a lot of immunity. Whether he's not had it since. My daughter, 2 weeks later, to the day, in order of age, in the hospital at Oil City, old Oil City Hospital, 106 fever, nearly life flighted her here, 2 children. How's that? 3 kids, same household, not biological siblings, mind you, so there are no genetic tie-ins. 3 different presentations from normal to mild to, oh my God. That was interesting. So all of it, extremely contagious. It's us. Case very high with newborns. Baby born mother had chickenpox early in pregnancy. A lot of problems. All of those types of things. So if you're exposed to shingles and you had never been exposed before, that's when it would become chickenpox. Now the treatments with the acyclavirs, again, no aspirin. Look, a lot of people, there's been a shingles vaccine around for a long period of time. Reduces the risk. Did I have one? No. Immunocompromised, much more of a problem. There. That's the saga for that. Which brings us to the measles. Measles are, and I see it all the time, malaria, HIV/AIDS, measles, 3rd largest killer in equatorial Africa. There's absolute, because they won't tolerate the vaccine. To not tolerate physically, accept it. Because, and there's very good evidence, as I've said to you before, that the vaccine that they developed to try and polio terribly, illegally, heinously developed diseased monkeys to make polio vaccine is likely the start of HIV. It was likely a lab that would have dirt floors with sick monkeys. There's a lot of evidence to support that. Long story short, they're not getting the MMR. That's why we see a lot of cases there. Measles has a comparatively high. It's not like where we live. Our mom said, you get out of bed. Well, they threatened you with bodily harm. And my mom would have killed me. You will not get out of bed. You will not go to school. You will not play with your kids. You have to sit and lay in bed and watch TV. Okay, twist my arm. I'm good with that. Is there any food limitation? No. I'm in. That could be my happy place. So, no longer endemic, okay? This is one of that resurgent disease. Take a look. This is 8 years ago. We're seeing more and more. There are a lot of clusters I've been telling you about. All of these things are absolutely covered, and these are almost all macules. It's very, very flat, covered. Secondary problems with pneumonia, encephalitis is rare. This is rarer still. Some aspect of this virus embedding itself in brain tissue causes this, what's called SSP, subacute sclerosing panencephalitis. That's fancy term for a viral particle damaging these cells and over time becoming fatal. All of the above. Risk, all of these have a significant risk with pregnancy. Thank you very much. The other name is rubiola. It's a paramyxovirus. Okay. The pathogenesis is fairly straightforward. Respiratory, spreads by way of the lymphatics. Rash from cell-mediated immune response. These you see, they're called Koplik spots. It's almost like, they look like tiny granules of salt, like not rock salt, like, unground salt, coarse salt. Okay, that you see adjacent to, like, back in the cheek and areas. I mean, that's one of the things you would look for. All of those things, 1 to 2 per 1,000 cases fatal in the U.S. And we see them now. That's why nobody ever died from measles. Oh, yes, they have. That's the mistake of, there's a lot of vaccines I don't think are worthwhile, worth the risk. This one certainly is. The MMR. Okay, we're the only natural host. But notice 99%. Every time you hear about a measles outbreak, the frame, so they get clicks on whatever website you're looking at. Most contagious disease we know, new outbreak. It's the measles. It's the most contagious disease we know. Notice, and these are typically unvaccinated population in areas that are poor, underserved. Read that as a lot of sub-Saharan Africa. No antiviral. It's all about the vaccine. It's there. And maybe the last little nugget of this is German measles. The least is called rubella. It is the least problematic. I never had the bumps. I had measles, mumps, measles, German measles, and chickenpox. I barely knew I had this. I had it when I was in high school. The most I can feel them to this day. Lymph nodes here. The preauricular, before the ears, lymph nodes, big bumps that were there, painful, low-grade fever. Happened right before prom. That's why I didn't want to miss school. Got it? Okay. Does not have the diagnostic lesions. I didn't have anything like that. This is the problem. And I got yelled at deservedly by a gal. We were doing driver's ed. And I'm in the car with this developing, and you're contagious before it starts. And when she heard I had German measles, she gave me what for. My sister is pregnant, and blah, 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 blah. And it was very inconsiderate just because she was absolutely right. I was not aware at that point how dangerous it was for the unborn child. Didn't pay, you're only concerned about yourself. So you don't think in the prison of somebody else. Nor did I didn't know she had an older sister who was pregnant, certainly. She lived, 2 streets over from her. It's a toga virus. This is the big problem. And what it does, and I've said this to you before, we had so many kids with hearing aids, going to speech classes, some visual problems. It affects the sensory nerves early in gestation. We don't see it that much now. We do not. In my generation, it was extraordinarily uncommon not to have somebody in your class who didn't have a hearing aid, and it's all about, as far as I was concerned, rubella. Respiratorily spread, lymph nodes again, into the bloodstream, immune comp, so it's like many viruses, immunological, the responses, not toxins. Virus particles cross the placenta, not a lot of viruses do, commonly causing deafness. There is congenital rubella syndrome, okay, with all of these things, and most of them are nervous system. This is very, very severe. That was there. Humans only. This is the point, contagious before you actually see the rash. Pre-vaccine, 10 to 15% only. 85 to 90% of us got it. This was the so-called rubella bulge. All of these things, hearing impaired children affected educational system for decades. This happened after I was telling. So in 64, I was, those were kids who would have been, when I was in high school, would have been just starting grade school. we're there. And every so often we get a spike. These types of things, there's certain spikes. Maybe there's a problem with a vaccine, etc. Those types of things are there. We don't see very many cases. And okay, let's stop it here. We'll finish this up on Friday. There's not a lot left. This is the number classification. That's how Fifth's disease became Fifth's disease, etc. We'll finish up with that. Thank you very much. Again, hopefully we'll have no problems with the exam. You have the whole day to figure out when to start it. Whatever suits your calendar, and thank you. Why can't I see this?